Thank you, chairpersons. So in this topic, I am going to discuss about current evidence on uses of liraglutide in diabeticity. So I will outline how I will describe this topic. First of all, I will describe the term diabeticity and why describing this term is important for management of patients with obesity and diabetes. What effect it occurs because of the obesity and insulin resistance, and that is why we have to address the entire spectrum of the metabolic syndrome. Where the molecules like GLP-1 analogs fall into managing the patients with diabeticity and metabolic syndrome, and specifically the evidence of liraglutide in addressing the various aspects of diabeticity and metabolic syndrome, with a focus on a biosimilar liraglutide, which is recently been available in the Indian pharma market in last 1 year. So I will describe also about the data of the biosimilar liraglutide, its PK data and phase 3 trial data, and how it compares with the innovator liraglutide. So this is my disclosure for today's presentation. With this, I will directly go to describing the diabedicity. It is a term which is not new. It was actually described in 1970 by Sims et al. Yeah. So the diabeticity term is not a new term. It was actually described as old as 1970 by Sims et al., which actually describe the correlation between the obesity and diabetes, and how the obesity can cause the insulin resistance and culminate into not only diabetes but also the various metabolic syndrome. So that is why when you see your diabetic patient which is either obese or overweight, you should not only focus on reducing the blood glucose level, but you should also focus on reducing the body weight and to reduce the insulin resistance. So this is all are part of the diabesity. Because of the obesity, patient of course have the diabetes. Along with that, patient may have the MASLD, that is a metabolic dysfunction associated steatotic liver disease, which is a new term for the NAFLD. OSA, CKD, of course these patients are prone to cardiovascular disease and dyslipidemia and hypertension. So these are all the issues associated with the insulin resistance and obesity, and which we need to address for these patients. So what are the goals of the treatment whenever you see those patients in your clinic? Not only the glycemic management, but also the weight management. Apart from the weight management, glycemic management, you should focus on the cardiovascular risk management, that is your hypertension, dyslipidemia management. And then you should also focus on a cardio-renal protection from the beginning of the patient when they enter into your clinic, even before they have developed those disease, so that we can prevent those diseases in these patients. So these are the goals of the treatment whenever you see the patients of obesity with diabetes. And this is the image which shows the pharmacological effect of GLP-1 receptor analogs, how it affects the various organs like pancreas, where specifically it increases the insulin secretion, and other organs like heart, adipose tissue, kidney, muscle, liver, all are affected by this molecule, and all organs have the beneficial effect of GLP-1 pharmacological actions. So this is how in pancreas it increases the insulin secretion and decreases the glucagon release. In liver, it reduces the gluconeogenesis and increases the glycogen storage. At the central nervous system, it reduces appetite, so that's why it is beneficial for obese patient. In gut, it slows the gastric emptying, so patient will always feel full of the meals and he will have a reduced appetite. It also has a leuotrophic mechanism of action for cardiovascular protection, from reducing the systolic BP and to protecting the endothelium function. It also causes the increased diuresis and natriuresis, and that's why it has a protective effect on the kidneys. So you can see all the important organs of the patients in the diabesity are beneficially impacted by the GLP-1 receptor analogs. And that is why if you see the recent ADA 2020-25 guidelines, it not only focus on the glycemic management, but it also focuses on the holistic management of this patient, and you will see that GLP-1 receptor analogs are at number 1 places at many areas. For example, if your patient is having a high weight, a very high body weight, then the agents which are listed by the ADA are the GLP-1 receptor analogs and GLP-GIP dual agonist. If your patient requires a very high efficacy for the glucose lowering, again the GLP-1 receptor analogs are number 1 molecules. The patients who are having a ASCVD or very high risk for the ASCVD, GLP-1 analogs are the number 1 agents for preventing those diseases in the future. Again, after the studies by the various GLP-1 receptor analogs on the kidney benefits and flow trial data, Now, if you see the CKD patients also, after SGLT2 inhibitors, you should focus on GLP-1 receptor analogs for the treatment. And of course, the patients who are having a MASLD, here also, the GLP-1 or GIP-GLP combination along with the pioglitazone has a significant role. So you see, the GLP-1 receptor analogs actually dominate the ADA guidelines for various patient profiles. So what will you expect when you give this molecule to patients of type 2 diabetes? You expect it to improve the glycemic control, you expect it to reduce weight, it provides the cardio protection, renal protection, and it also has a beneficial effect on lipid profile and blood pressure. So I will go through the various data of the liraglutide in the lead trial, which was the phase 3 clinical trial program for the liraglutide. And majorly I will highlight here is that in this trial, liraglutide was used with different OADs and insulins. And here you can see the efficacy for the HbA1c reduction was around 1 to 2%. See, in all this trial, irrespective of the baseline OADs or insulin therapy, the liraglutide has shown to reduce the HbA1c in the tune of 1 to 2%. So what is the problem in the India as of now? Till last year, when the GLP-1 receptor analogs were patented and they were available at a very high cost, which most of our Indian patients are not able to afford. Even though we knew that these molecules are wonderful for the diabetes management, it has a leukotropic beneficial actions on the cardiac safety, CV safety, renal safety, but we could not use that up to its potential, although they are number one into the guidelines, but we could not use in the practice because of the one reason, that is the cost of the therapy. The cost of the therapy till last year was the 10,000 rupees per month, which is very, very high for most of the Indian patients. So now that problem has been solved by many Indian companies who have bring the liraglutide biosimilars. So in this study, I will compare the data of the liraglutide biosimilar, which is a biological product of original liraglutide, and I will compare this biosimilar with the reference liraglutide. So whenever a country approves, a DCGI approves a biosimilar, we have to provide the PK/PD data and phase 3 clinical trial data of showing the equivalence with the original innovator product. So here you can see the PK/PD data with the single dose of the liraglutide, where liraglutide biosimilar was compared with the original liraglutide, that is the innovator liraglutide. And here with Cmax and area under the curve, the ratio between the Cmax and area under the curve of the test versus reference product should be between 80 to 125%, and then you can establish that the product is biosimilar with the innovator product. And here you can see in all the aspect, the ratio falls into that category. So the single dose PK parameters were established with the original liraglutide. Similarly, for the multiple dose study of the PK study, here also the Cmax area under the curves are matching with the innovator liraglutide. So PK/PD was established and it was shown that the biosimilar liraglutide is equivalent or bioequivalent with the original liraglutide. Now let us see the phase 3 clinical trial data in the Indian patients of this liraglutide biosimilar. So here the objective was to compare with the innovator liraglutide, and total 256 diabetic patients were randomized to receive either liraglutide biosimilar, that is a 128 patients, or liraglutide innovator, that is also 128 patients. And these patients were followed for 24 weeks. The primary endpoint was HbA1c and the secondary endpoints are fasting PPG and change in body weight. Now you can see the reduction in the HbA1c. It is excellent and it is comparable with the original liraglutide. The reduction in the fasting plasma PPG is also comparable with the innovator liraglutide. The reduction in the body weight was shown here is in the tune of 1.5 to 2 kg. It is also comparable with the innovator liraglutide. Regarding the safety data, because whenever we compare the biosimilar, the safety is also utmost important. But safety also you can see there is no major serious adverse events. Most of the adverse events are seen with the product are either mild to moderate, and it is comparable with the original liraglutide. And these adverse events are mostly as we expect with the liraglutide, like nausea, vomiting and diarrhea. So that is also comparable with the original liraglutide. So there are no major safety concerns also for this new liraglutide biosimilars, and it is comparable in terms of the safety and efficacy with the innovator product. So with this, let us see the various evidences of this molecule in patients of treatment of diabetes with obesity. If you see the India, The prevalence of diabetes is 11%, pre-diabetes 15%, but if you see the prevalence of obesity, it is even higher, 28%. But if you measure the obesity by abdominal waist circumference, it is 39%. So many of the Indian patients are obese when you measure them correctly with the waist circumference, and that is why this obesity is a huge challenge for the Indian patients. So if you see the ADA guidelines, ADA clearly says that if your objective for the patients of diabetes is the weight reduction, then the semaglutide and tirzepatide are very high efficacy molecules, followed by the dulaglutide and liraglutide. So liraglutide here comes here, which is above the SGLT2 inhibitors. So as compared to the SGLT2 inhibitors, GLP-1 receptor analogs have a high efficacy of reducing the weight. So you should prefer those molecules for your obese diabetes patient. And this is a scale randomized control trial in patients of diabetes, where they enroll the patients of diabetes with HbA1c between 7 to 10% with BMI of 27 or more. And here they have classified the individuals into placebo, liraglutide 1.8 or liraglutide 3 mg, and then they have seen the reduction in the body weight. Clearly you can see here when the placebo has reduced the body weight by 2%, with the 1.8 mg it was 4.7%, and with the 3 mg it is a 6% with the liraglutide. So there is a significant reduction in the body weight with liraglutide. This is a second study where again liraglutide was compared with the placebo and orlistat, which we used to use in our diabetic obesity patient for reducing the weight for the weight management. Here also you can see, as compared to orlistat, all the dose of the liraglutide had a significant reduction in the body weight, and for the liraglutide 3 mg it is as close to more than 8 kg of reduction in the body weight. So liraglutide from 1.2 to 8 kg has shown excellent reduction in the body weight, which is higher than the placebo and higher than the orlistat. The percentage of patients who achieved the reduction in body weight of more than 5% are 52% with the liraglutide 1.2 and 53% with liraglutide 1.8%. So more than 5% body weight is also achieved excellently in most of the patients. If you see our Indian data, that is a liraglutide biosimilar data. This is a post-hoc analysis. So the trial which I have shown you for the efficacy data, out of the 256 patients, they have divided again those 256 patients based on the BMI, and those patients who have a high BMI of more than 25 were classified, and then they have seen the weight effect with the liraglutide biosimilar. Here also you can see biosimilar reduced the body weight by 5.5 kg, which is similar to the innovator liraglutide. So even in the weight management, the liraglutide biosimilar is showing the excellent efficacy, which is at par with the innovator liraglutide. These are the glycemic benefits, which are also comparable with the innovator liraglutide. And this is the meta-analysis of the all liraglutide trial, which enrolled more than 6,000 patients. And here you can see all the dots on the forest plot are on the left side of the zero line. So that means there is a significant reduction in the body weight with all the trials of the liraglutide, with the mean reduction in the body weight being a 4.81%. But if you see the Indian data by different investigators like Dr. Jyoti Dev, and here you can see the reduction in the HbA1c in those Indian trials, they range from 1.5 to 2.5%. While if you see the original liraglutide trial by the Novo Nordisk, the reduction in the HbA1c is only 1 to 1.5%. That means in Indian patients, the reduction in the HbA1c can be much higher than what has been shown in the Western data. Similarly, for the weight reduction also, you can see in this Indian investigator studies, the reduction in the body weight is all more than 5 kg, and Dr. Jyoti Dev has shown that reduction can be up to 8.65 kg also. So again, the reduction in the body weight shown by the innovator data is much lower than as seen with the Indian studies, which have shown reduction in the body weight more than 5 kg and up to 10 kg also. So again, shows that this molecule is having a excellent benefit with the Indian patients. If you see the patients of MASLD, that is a metabolic dysfunction associated steatotic liver disease, again the liraglutide is having a good benefit as per the ADA guidelines, and this is the study done in the patients of diabetes with fatty liver disease. Here liraglutide has shown this is the BMI, it improves the waist circumference, it improves the visceral body fat, and it also improves the subcutaneous fat also. So that is all beneficial for the patients of diabetes with MASLD. Now finally coming to the cardiovascular benefit of the liraglutide. This is the famous LEADER trial, which was published in the NEGM, and it is one of the first molecule which has shown the cardiovascular benefit by any anti-diabetic agent. And here you can see liraglutide has shown to reduce the 3-point MACE by 13%, clearly showing the superiority over the standard of care. And the death from the CV are reduced by 22%, again clearly showing the CV benefits. And finally, renal benefits. If you see the ADA guidelines, ADA clearly says that patients of CKD should not only receive the SGLT inhibitors, RAS inhibitors, but after that, if you want additional sugar control, the patient should receive the GLP-1 receptor analogs. And the beauty is that you can give the GLP-1 receptor analogs up to eGFR of 20 also. So with that, liraglutide again is showing a good renal benefit here in this. You can see in LEADER trial, liraglutide has reduced the renal endpoints by significantly by 22%, and microalbuminuria was reduced by 26%. And all the GLP-1 trials, here you can see there is a significant improvement in the renal endpoints and microalbuminuria with all the GLP-1 receptor analogs. So this is a molecule which is also beneficial for CKD patients, and this is again the data of liraglutide biosimilar, where there is a slight improvement in the creatinine and improvement in the eGFR also, and which was comparable with the innovator liraglutide. So with this, I have narrated all the aspect of liraglutide and how it is beneficial in patients of diabeticity, where not only it provides the glycemic benefits, weight management, but it is also beneficial for reducing the CV risk. It is indicated for the renal patients, and for the patients of MASLD also it provides the various benefits. And in the future there will be a ESSENCE results from the ESSENCE trial data which also establish this molecule GLP-1 receptor analogs in the treatment of MASLD. So now in the India we have the luxury of using this molecule liraglutide biosimilar, which is available at a very affordable cost. If you see the current cost of the therapy with the single pen, it comes with the 2,000 rupees per pen, and if you divide by 30 days, it comes to only 66 rupees per day, which used to be like for SGLT inhibitors in the earlier days. So now it is available at a very affordable price, and so we can use this molecule more extensively nowadays in our diabetes patients who have obesity, and this can be the first line therapy in the India also in the future. So with this, I thank you for your patient listening, and now I hand over to chairs. Thank you.